Hey guys, welcome to Medifaction. Today, let's learn about epistaxis. So, what do you mean by epistaxis? It is nothing but the bleeding from inside the nose. So, before moving into detail, let's learn about the blood supply of both nasal septum and lateral wall of the nose. So, here we can see the nasal septum. So it has both the internal carotid artery supply and also external carotid artery supply. In internal carotid artery system, there is contribution from both anterior ethmoidal artery and posterior ethmoidal artery, which are branches of ophthalmic artery. Whereas in case of external carotid system, we have sphenopalatine artery, which is a branch of maxillary artery, as you can see right here, and it gives the nasopalatine and posterior medial nasal branches. Also we have the septal branch of greater palatine artery, which is a branch of maxillary artery right here. After that we have the septal branch of superior labial artery, which is a branch of facial artery right here. So this is the blood supply of our nasal septum. Now let's see the blood supply of the lateral wall. The lateral wall also consists of blood supply from the internal carotid artery system and also external carotid artery system. In internal carotid artery, we have anterior ethmoidal artery and posterior ethmoidal artery, just like the nasal septum, which is branch of ophthalmic artery. Moving on to the external carotid artery system, we have blood supply from the posterior lateral nasal branches, greater palatine artery, right here, lesser palatine artery, right here, and also nasal branch of anterior superior dental, and also we have facial artery, which gives branches and which supplies to the nasal vestibule, and also from sphenopalatine artery from maxillary artery right here. This is the maxillary artery, and we have the sphenopalatine artery, and also from infraorbital branch of maxillary artery. Now let's talk about the little's area. The little's area is situated in the anterior inferior part of the nasal septum, right here. This little area consists of four arteries, which are the anterior ethmoidal artery, right here. This is the anterior ethmoidal artery, septal branch of superior labial artery. This one is the septal branch of superior labial artery, and also septal branch of sphenopalatine, and this is the septal branch of sphenopalatine, and also the greater palatine right here is the greater one. So all these arteries come here and anastomose at this anterior inferior part known as little's area. So why this is very peculiar? This is peculiar because it is the usual site of epistaxis in children and young adults. Now let's see the causes of epistaxis. It will be divided into local causes and general causes. In local causes, first of all, we have trauma like fingernail trauma, injuries to the nose, and even intranasal surgeries. Other causes under local, we have infections such as acute and chronic. In acute cases, it may be viral rhinitis, nasal diphtheria, and acute sinusitis. Whereas in case of chronic infections, there will be crest-forming disease such as atrophic rhinitis, rhinitis zika, tuberculosis, syphilis, septal perforation, granulomatous lesions of the nose like rhinosporidiosis. Other causes may be like foreign bodies. Foreign bodies, it may be non-living like any neglected foreign body like rhinolith, etc. And whereas in living foreign bodies such as maggots and leeches can cause epistaxis. Another important cause under local is nothing but neoplasms of the nose and paranasal sinuses. It may be malignant or benign. In benign, we have examples such as hemangioma and also papilloma. Under malignant, we have the carcinoma or sarcoma. Other cause like atmospheric changes due to high altitudes, sudden decompression can cause epistaxis, and also deviated nasal septum can also cause epistaxis sometimes. Now let's move on to general causes. In general causes, we have reasons like cardiovascular systems causing hypertension, arteriosclerosis, mitral stenosis, pregnancy. During pregnancy, there may be chance of hypertension and due to hormonal causes. Next, we have disorders of blood and blood vessels like aplastic anemia, leukemia, thrombocytopenic and vascular purpura, hemophilia, Christmas disease, scurvy, vitamin K deficiencies, all these can lead to epistaxis. In liver diseases, there may be hep- hepatic cirrhosis, which may cause deficiency for factor 2, 7, 9, 10, etc. In case of kidney diseases such as chronic nephritis can also cause epistaxis. Drugs. Excessive use of salicylates and other analgesics such as for joint pains or headaches can cause epistaxis and other anticoagulant therapy for heart diseases can also cause epistaxis. Another reason may be mediastinal compression. This may cause be due to tumors of mediastinum, and this causes raised venous pressure in the nose, resulting in epistaxis. Acute general infection, such as influenza, measles, chickenpox, whooping cough, rheumatic fever, infectious mononucleosis, typhoid, pneumonia, malaria, and dengue fever. Also, viscerous menstruation. Epistaxis occurring at the time of menstruation. Now let's see the classification of epistaxis. There may be anterior epistaxis and also posterior epistaxis. So now let's see the difference between the both. Which is the most common one? Obviously, the anterior epistaxis is more common. The site for anterior epistaxis is mostly from the little's area, which I have mentioned earlier, which is seen in the anteroinferior part of the nose. In the posterior epistaxis, it may be due to the posterior superior part of the nasal cavity, often difficult to localize the bleeding point since it's in the posterior part. Age. For anterior epistaxis, it mostly occurs in children and young adults, whereas posterior epistaxis is more common among 40 years of age, after 40 years of age. Cause. Anterior epistaxis is mostly due to trauma, whereas posterior epistaxis is spontaneous, often due to hypertension or arteriosclerosis. In anterior epistaxis, the bleeding is usually mild and can be easily controlled by local pressure or anterior packing, which we will be discussing later. Whereas in case of posterior epistaxis, the bleeding will be severe and requires hospitalization and post-nasal packing will be required. Now let's move on to the management of epistaxis. In any case of epistaxis, it is important to know that the mode of onset of the epistaxis, whether it is spontaneous or fingernail trauma. The duration and frequency of the bleeding is also very important. The amount of blood loss, the side of nose where the bleeding occurring, where the bleeding is of the anterior or the posterior type, any non-bleeding tendency in the patient or family, history of non-medical alignment such as hypertension, leukemia, mitral valve disease, cirrhosis, and even nephritis. And also, history of drug intake is also very important. Most of the time, bleeding occurs from the little's area and can be easily controlled by pinching the nose, as you can see here, with thumb and index finger for about 5 minutes. This compresses the vessels of the little area and stops bleeding. In Trotter's method, the patient is made to sit and lean forward over a basin to spit any blood and breathe quietly from the mouth. The cold compresses should be applied to the nose to cause reflex vasoconstriction. Next type of management is cauterization. Here, this is useful in anterior epistaxis when bleeding point has been located. The area is first topically anesthetized and the bleeding point is cauterized with a bead of silver nitrate. Now let's move on to anterior nasal packing. In case of active anterior epistaxis, nose is cleared of blood clots by suction and attempt is made to localize the bleeding site. If bleeding is profuse or the site of bleeding is difficult to localize, anterior packing should be done. So how anterior packing is done? For this, we use a ribbon gauze soaked with liquid paraffin and about 1 meter gauze, which is 2.5 centimeter wide for adults and 12 millimeter wide in children, is required for each nasal cavity. First, few centimeters of gauze are folded upon itself and inserted along the floor. As you can see here, it will be inserted like this on the floor of the nose, and the whole nasal cavity is packed tightly by layering the gauze to the roof right here like this. And packing can also be done in vertical layers, as you can see in picture A. So one or both cavities may need to be packed, and pack can be removed after 24 hours if bleeding has stopped. Sometimes it has to be kept for 2 to 3 days. In that case, systemic antibiotics should be given to prevent sinus infection and toxic shock syndromes. Now let's move on to the posterior nasal packing. This is required for patients bleeding posteriorly into the throat. So for this, a post-nasal pack is first prepared by tying 3 silk ties to a piece of gauze rolled into a shape of cone. After that, a rubber catheter is passed like this. This one is the rubber catheter. A rubber catheter is passed through the nose and its end brought out from the mouth, and the ends of the silk thread are tied it to the catheter withdrawn from the nose. Pack which follows the silk thread is now guided into the nasopharynx with the index finger, and the anterior nasal cavity is now packed with the silk threads, as you can see here. And also, it will be tied over a dental roll. The third silk is cut short and allowed to hang into the oropharynx. As you can see right here, it is cut and it is hung on the posterior aspect. The next type of management is by elevation of mucoperichondrial flap and submucous resection, that is SMR. In case of persistent or recurrent bleeds from the septum, just elevation of the mucoperichondrial flap and then repositioning it back helps to cause fibrosis and constrict blood vessels. The SMR operation can be done to achieve the same result or remove any septal spur, which is sometimes the cause of epistaxis. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thank you for listening.